Hello friends, my name is Dr. Jyoti Gupta and as you all know that this channel is all about health and happiness. If you have been through this channel, you must be knowing that all the videos that I put in are about health and happiness, and what I try to bring about is a change in the way we think about health. And there are so much ways of getting information around these days that every information that you get may not be an authentic information. So I try to bring the information at a level which is authentic, factual and evidence based. That is what I can do as a doctor for you all. So today we will be discussing a very important topic. As we all know that because of the corona pandemic, we are all stuck inside, we're all locked in, and more so this has taken a toll on the students and the children. So they are these days being exposed to virtual classes, more on screen time, and as we always say and we know that technology has both its pros and cons. The teachers are trying really hard to make the children study and get across the message that the education should go on, the information, the knowledge seeking should go on, and they're trying really hard for it. But as we have to do it through the online classes, there are certain issues that parents are worried about, largely the health issues on the kids' health and how to deal with them. So we will be discussing about this, and before we start, I would like to credit this video to a very good friend of mine who's also a teacher, Nidhi Sindwani. She's a wonderful teacher and a lecturer, economics lecturer if I'm right, in DPS, and she brought this to my knowledge that this is something that needs to be discussed about, because there is so much that is being talked about at this topic and every information may not be the right information that reaches you. So today we'll try to do that. As it is a vast topic, it is not easy for me to cover it in one video, so I have planned a 5-video series where we'll discuss about the impact of online exposure or the increased screen time or the online classes on children and students. So this is very important for the parents to understand, and I hope I can bring my message across to you all. So in this 5-video series, the first video that we're doing today will be about the health risks that are involved with increased screen time and certain general measures that you can take to make the impact lesser. Second video will be about the ergonomics, or as we say, the position and the posture. The position of both the child who's watching on screen and the screen itself. The posture or the position of both of them is very important. So the second video series will be about how a child or a student should be sitting in front of the device or the computer screen to make the impact lesser. The third video will be about certain things that we can do for screen adjustments that can be done to again cause lesser impact on the health issues that we are going to discuss. Fourth will be about what screen time do we say is too much screen time, so we will have a talk about it. And the fifth topic will be about what tips can be given to parents, or what measures can parents take so as to reduce the screen time for their kids. So we'll be doing this in 5-video series. Let me start the first one for you. So as I said, today we'll be discussing about the health issues. So if I try and classify the health issues, they can be classified into 3 major categories. The physical health, so the impact on the physical health, the psychological health of the child, and the social impact. So let us go ahead. As you understand, as I said, it is important that these classes go on. We cannot stop these classes, but we as parents need to understand the impact these classes can have. So let's talk about the physical impact that can happen. As they have to watch those screens for a longer time, because there are many subjects that need to be covered, many topics that need to be covered. So the increased screen time can take a toll on their eyes. How? Let's find out. Because they have to focus all the time on those screens to understand what is going on. The eye muscles get strained, more so because all the information that they gain is through near vision. So all that they are being exposed to for a long time is using the muscles for near vision, and that too in an unnatural light. We are sitting in our homes and watching those screens. We are losing on the natural light that we see in our schools and colleges when we attend them. So unnatural light, increased near vision time, both these things take a toll on the eye health, and the eyes muscles get strained and start aching and paining. That is the impact on the eyes. And also there is a very, very important syndrome that we need to talk about called the computer vision syndrome. We'll talk about it in a while. Before that, let's try and understand the other health issues. So be with me, because we need to talk about the computer vision syndrome in a while. So to understand this, let's understand the other aspects. So one is the impact on the eyes that we discussed about. The second impact is on the back muscles, because they have to sit all the time in front of those screens. It can take a toll on their back muscles also. The muscles get strained because of continuously sitting. We are not moving around, walking around, and there are things that we do in our schools and colleges that we can't do when we're sitting in the front of the screens that we have. So the back muscles get fatigued. Also the muscles and joints of other body parts like our legs, knee joints, ankle joints, even the elbow joints, all these joints can get fatigued and can get affected by the continuous sitting in a particular posture, which is so often when we are in front of our screens, especially if we are children. As teenagers and adults, we still understand that we need to keep moving all the time, and we try and not strain our muscles so much. But as children, we try to focus so much on what our teacher says. As you know, in schools, whatever teacher says is the final words for these little kids, and so they really, really try and focus on what their teacher is saying, and thus the muscles and joints can get affected. So we discussed about the eyes, the back muscles, the muscles and joints of arms, forearms, and the legs. Also, because of all that attention and fatigue, the eyes get strained, and many children start complaining of headache. Headache also causes some strain in the neck muscles, and such patients or such children can also have dizziness or vertigo, and it is also a problem of focus. So all in all this leads to an altered sleep pattern, and there are many children who report to us saying that they can't sleep well these days. Their parents come and complain that my child is not able to sleep as well as the child used to a few days back or earlier. So the sleep cycle also tends to get disturbed because of the light, the unnatural light that they live in, and the exposure of the electromagnetic light that emits through these screens. So this is about the physical health, and this is really important. As I talked about a number of health issues, please do not get worried. Do not be alarmed of the fact that you stop taking the virtual classes. These are important and need to be taken. There are measures that can also be taken alongside. We will discuss about them. Let's talk about the psychological issues. What psychological issues can such children face? Because they have to focus on the screens all the time, and every child has a different way of understanding things. The pace or the speed of understanding things is also different for different children, and the children may not be as vocal over the screens as they are when they are in front of their teachers face to face. They can ask a number of questions. The time during the online classes is limited, and the children may not be able to ask such questions, and sometimes they lose focus because the second topic is started, the slides are moved on, and the child does not understand what was done in the past slide, and also fears to ask it sometimes because they cannot very well see the teachers and connect with them. So certain psychological issues may arise. There can be attention disorders, there can be focus disorders, there can be some problems like anxieties in such children. Unfortunately, some children may also face depression. So that's a word of caution for all the parents. Please be aware of how your child is taking these classes. If you are present alongside them, very, very good. If you cannot be because of the other works you have, the household works or the office works that you have, please come back home and ask your children how the classes were, what did they study, and other than this, please also ask them if they faced any kind of difficulties during these classes. Connect to them, speak to them. It is very, very important. So these are the psychological issues that child may be facing. Also, there are certain social issues, or I should say socio-psychological issues, because the world of internet is such an addictive world that the students or the children may tend to get addicted to the internet world. That also creates sometimes a security issue, because there are some online predators, as you all know, who know that the children of all age groups are in front of these screens, especially more so these days, and certain filters, if not strong enough, can lead to pop-up of the content which you would not want your child to see. Inappropriate contents, inappropriate pictures, unhealthy advertisements. We should be aware about them. So connect to your children so that they can be vocal about it if any such incidents happens during their classes. Although I am very sure all these schools and teachers are taking all the right measures, strong filters are being put in, and such kind of mishaps are being avoided to the fullest, but still keep a watch, talk to your child. Also, there is a concern about social isolation, as the children are not able to meet their friends, talk to their friends, and even talk their heart out to their children, to the other children and their teachers. As I said, teachers are kind of their best friends. Every child has one or two or maybe three those special teachers that they really like and listen to. They may sometimes not be listening to their parents, their mothers and their fathers, but will keenly listen to what their teacher says. Now this connect is getting a little weaker because the children are not being, they are not seeing all these teachers and fellow students face to face. So sometimes social isolation becomes a habit, it becomes a trend. Initially the child may get depressed, may get unhappy with the fact, miss the friends, but if this continues and we don't talk this out to our kids, we don't get ourselves involved with our kids, sometimes they create an atmosphere around themselves which is of social isolation. They start enjoying being alone, being aloof, being lonely, and then certain problems socially can arise for these children. So these are the important health issues that we need to know about. And also, as I said, I would talk about a syndrome which is called the computer vision syndrome, something that all the parents should know about. It is actually a syndrome that is caused by the increased screen time. What is it? As I said, the eyes may get strained, so the children may present with certain symptoms like fatigue. They may feel weakness all the time. The eyes may have certain problems, like there may be blurring of vision, they may not be able to see properly, and they may have problem refocusing. There may be double vision as well. There may be dry eyes. The eyes may get dried up because usually when you are concentrating a lot on the screen, your blinking rate gets decreased by 1/3 of the actual blinking rate. So they may have dry eyes, irritation of the eyes, headache, diplopia or the double vision, as I said. Can have another impacts like neck pain, vertigo, dizziness. All this comes under the category of computer vision syndrome. If your child is facing all these problems, please get him or her checked by a good eye doctor, ophthalmologist, to find out if such a thing is there which is causing a health issue. Now we've talked about the health issues. Before I end up, I'll discuss certain general measures that you can take, although I'll take these measures in detail in another video, but certain tips and tricks that you can use. One, as I said, the blinking rate is reduced. Ask your children to blink a number of times consciously. We usually blink unconsciously, we don't even get to know about it, but these days, please ask your children if they are spending a lot of time on these screens, ask them to blink once in a while so that the tear film in the eyes gets replenished and the problem of dry eye is less. So blinking is one thing that can be done. Second thing is eye massage. what these children can do is rub their hands, warm their hands, and then use the warmth of their hands to press upon their eyes and massage them gently. But before you do this, you also need to understand about the hand hygiene. Make sure your child washes the hands frequently, a number of times, and only with washed hands does these eye massages, or you can do these eye massages for your child when you are free. So blinking is important, eye massage is important. Also, what is important is to understand that the children need to take breaks. Tell them, if possible, between the classes, move around a little, make their body parts active, and just shake their legs and shake their hands and arms and be active. If they cannot move around, at least take a break from the screen and move the eyes around. And follow one very important rule that is called as the 20-20-20 rule. Very, very important to understand. I would ask all the parents to listen carefully and understand what this rule is. 20-20-20 rule means that ask your child to look at a distant object after every 20 minutes of the screen time. And the object should be at around the distance of 20 feet, at least 20 feet or more from their eyes. And watch such objects for at least 20 seconds. So 20 seconds every 20 minutes, 20 feet away. A very important rule which can really help keep the eyes and health of the children good the way we want it. So this rule needs to be followed and should be followed by all the parents. They should guide their children about this rule. So as I said, blinking is important, hand hygiene is important, eye massage is important, taking breaks is important, 20-20-20 rule is important. Also, a thing that came to my attention recently was I was told by a parent that their child in the morning, because has to go for the classes and is getting late because the children tend to sleep late and get up late, takes shower in the contact lenses. No, that's a complete no. In fact, when you are attending these virtual classes, please do not use the contact lenses at all. You do not need to. Specs are doing equally good job. Do not use the contact lenses, and not in the shower at all. Make sure you're not doing it. Also, I would request the parents to make sure that their kids are eating healthy these days. It is very, very important, not only for the eyes, the back, the muscles, but also for their overall health. So with this, I'll wind up today's video. As I said, one video cannot incorporate everything because it is a long topic to discuss and needs to be taken seriously. But I'll come up with the other videos in the coming series and try to find out the other aspects on what is too much of screen time, how children can sit, the posture and the position of the children to make the impact lesser, what should be the position of the screen to make the impact less, and what tips can parents use to reduce the screen time other than the virtual classes. Virtual classes are important, but even other than these classes, there are times that children are being exposed to screens when they're eating, when they are getting bored inside their homes, and when there is nothing else to do. All that they do is befriend these screens. We need to keep a watch on this. So with this, I'll wind up this video and hope you all liked and understood what I said. Please follow these things. They are very important and for your child's health. I wish all of your children a very, very good health and happiness. We'll see you soon with other videos. Before I go, would like to say, please like, share and subscribe to this channel so that I can bring more such informations to you, more some factual and evidence-based information to you. If there is anything you would really want to know, please write in the comment box. I would love to go through and answer to all your queries. Bye-bye and have a very happy and healthy life. Thank you.